try this again. Welcome to Health Sciences Librarians of Illinois, webinar on Health Science Archives 101. Thank you so much for joining us today. This topic has been on our list for a while, and the stars aligned at this time. I think I had hoped originally that we would have about 30 people on this session, and we have over 120 registered. So I think it's a topic of interest. I wanted to give just a few thank yous. First, to our speaker, Lisa Mix, who's been an absolute delight to work with. I'll give you more background on her in a minute. Thank you to JJ Pianki at UIUC for hosting our session today. We are very grateful to the National Network of Libraries of Medicine Greater Midwest Region for funding this session with an Expert Speaker Award. So thank you, GMR. And thank you to Ramuna Kabulius from Northwestern University, who has encouraged and promoted this topic, and she suggested Lisa as a speaker. So we're delighted to bring this to fruition. A little housekeeping: if you'll keep yourself muted as much as possible, that's helpful. You can put questions in the chat box and I will monitor them, but Lisa is also planning some breaks for questions, so you may want to hold off and ask questions then. And JJ suggested if we turn off our cameras, we might have less lag time and delay, so I suggest that we do that. We emailed a list of sources from Lisa to people who had registered by the end of last week. I'll put that link in the chat box, and it is also on the hsli.org website. So on to introductions. Lisa A. Mix has worked in archives at several academic medical centers. She was at NewYork-Presbyterian Hospital, Weill Cornell Medicine from 2011 to 2019 as head of archives, and then remotely as a senior archivist, where she oversaw digitization of handwritten medical casebooks. She was previously at Johns Hopkins Medicine in Baltimore and has also been at the University of California, San Francisco. Lisa is a Baltimore native and holds degrees from Goucher College and the Johns Hopkins University. Her professional interests include teaching with primary sources, digital archives, and archival ethics. She's published and presented widely on archives and the history of the health sciences. Lisa is the 2020 recipient of the Lisabeth M. Holloway Award from Librarians, Archivists, and Museum Professionals in the History of the Health Sciences, and she currently chairs the Society of California Archivists Advocacy and Public Policy Committee. She's a certified archivist and a digital archive specialist. We are delighted to have you here with us today, Lisa. I'm going to hand the screen over to you, and I'm sure we are going to learn a lot.
Thank you. Let's go to slideshow. All right, so are you all seeing this as a slideshow, I hope?
Yes.
Great, great. Technology working today, good. So, so welcome to Health Sciences Archives 101. And so as Frances said, I had sent ahead a handout with a bibliography and some links to online resources. And please don't feel that you had to have read or looked at any of those ahead of time unless you wanted to. I just didn't want people to have to be scrambling to write down titles and URLs and things. I wanted you to just have that on hand. And I'll say there are far more items on that document than I could possibly cover today. So you'll have lots to explore later on, depending on your interests and your needs. And as Frances said, there'll be a few breaks for questions throughout rather than holding them all to the end, because I thought that would be more efficient, so we could answer questions kind of throughout. Well, not throughout, there'll be 2 breaks within the session and then 1 at the end for questions. And I have some thank yous to say as well. Well, thank you all for coming. And, especially since I know that there are several other major virtual library events and conferences going on today. Thank you to the Health Sciences Librarians of Illinois for inviting me. And thank you, Frances, for helping set this up and for that generous introduction. And thank you to JJ Pionki for hosting and helping with the technical logistics. Thank you to Ramuna Kabilius for getting in touch and suggesting me as a speaker. And I also wanted to acknowledge Paul Thierman at the New York Academy of Medicine, because some, though certainly not all, of the elements of this presentation are based on a webinar that he and I presented in 2016 to the Mid-Atlantic region of the National Networks of well, it's the network of the National Library of Medicine now, easier to say, on archives in medical libraries. And I also wanted to thank Steve Greenberg at the NLM History of Medicine Division for bringing me up to speed on their current resources, and I'll be mentioning some of those throughout. And finally, I wish to acknowledge that I am speaking to you today from traditional and unceded land of the Gabrielino, Tongva, and Kizh nations. So a little bit about me, although this is redundant thanks to that generous introduction. So I've worked at several academic medical centers in archives. And I, in fact, most recently did a part-time stint at the Norris Medical Library at the University of Southern California. But enough about me. What about you? So I have the impression that many of the people in the audience here today you're an accidental archivist. You were trained as a librarian, but you've been given the charge of the archives collection or the historical collections at your institutions. So first, congratulations. Working with archives can be rewarding, it can be challenging and fun. And as librarians, you probably know a lot more about this than you think you know. Some of the concepts that I'm covering today will be familiar to you. You'll encounter some new terms or familiar terms used in a different way. Although I guess I should be clear though in saying I won't be turning you all into archivists in this brief session, but I hope to impart some basic concepts and tools that can get you started or help you to know what you don't know so that you can pursue further education as needed. And I'll say you are not alone, even if you are what they call a lone arranger. That's a one-person operation. There are professional associations and colleagues, national and local, who are ready to help. The National Library of Medicine, History of Medicine Division is great. They have a lot of resources, best practices. There are ways you can kind of get some quick wins by working with colleagues at NLM. And of course, you know, we've mentioned the network of the National Library of Medicine, your regional medical library, Greater Midwest region. And also there are many great just archives programs right in the state of Illinois. I mean, the University of Illinois at Urbana-Champaign has one of the most highly respected and robust archives programs in the country. And they're all nice people willing to help. And there are educational opportunities available through national and local professional organizations. And I'll be talking more about professional associations later, but the National Professional Association for Archivists is the Society of American Archivists, SAA, and I'll be mentioning their resources a lot today. And many of those are available to non-members. And they have a wide range of educational programs and publications to fill in the gaps in your knowledge. And the Midwest Archives Conference is one of the strongest regional associations. And there's even a local group that I discovered, Chicago area medical archivists. And so the URLs for SAAs and MACs education programs are on the resources handout. And I also thought I should mention that it happens that 1 week from today, your group in the Cataloging Maintenance Center is having a webinar on cataloging and metadata for archives and special collections called, Well, Isn't That Special? And I wish I'd thought of that title myself. So I checked this morning and you can still register for it. So, but it looks like that is going to be very specific to description and metadata. And I will cover that a bit in this, but today we're going to be more broadly ranging than that. But yeah, that looks like a good opportunity right there in the neighborhood. So, and I should say, like, about everything that I'm going to be telling you today, scale it to your situation. So I gather that a lot of you might be a one-person operation, which, you know, is so-called lone arranger, or you might even be a less than one FTE operation. You know, you might be a librarian, and archives, they say, well, this is 20% of your job or 50% of your job. So you can't do everything, and just let's all be cool with that. So oops, I skipped a slide here. Nope. I'm going to go back. Nope. Okay, here we go. So this is the SAA Core Value Statement, Code of Ethics. This is just the overview on this slide. There's the full document is there. And that's a good guide as you proceed through your archives career. It's a good source if you have ethical issues that come up. And so that URL, it's on your handout, and it's just a good resource. So there's some ways in which archives and libraries are similar. We share a core mission of service to our patrons and our public. We were both passionate about providing access to information, the right information, good quality information. And some of the functions of an archive, such as reference and collection development, are similar, and they're familiar to librarians, but they're the way in which these functions are performed in an archives is different, and it can be more intensive. Archives have rare and unique materials, and the archival processing, which we'll talk about, is a little different than library cataloging. And then one of the big ones is that there's mediated access. So reference is can be much more intense than just reference services in a library. And like everything else, a lot of this some of these functions and the way they're done have changed in the wake of COVID-19 and pandemic restrictions. So, but first let's ask, so what are archives? And here's a definition from the Society of American Archivists. And so I've bolded some key points that get at what belongs in an archives and what doesn't. So archives are records of enduring value, and they're meant to be kept permanently. And I should note that not all records should be kept permanently, but archives are evidence. They're documentary evidence of the activities of records creators and of those who interact with them. And they're maintained according to accepted principles and standards, and that are agreed upon by the profession, and they're updated periodically. And I'll be covering some of those standards today. And there's a standard section on your handout with links to several of those. So as I said, archives, they hold unique and rare materials that document individuals as well as key activities, functions, and responsibilities of an institution. And so that could include many things. That could include patient records, and a lot of people think of that when they think of a medical archives, but it's really just one component, and it's not usually not even the major component of medical archives collection. And you could have administrative records of hospitals and schools of medicine, school of nursing, school of pharmacy, school of dentistry, public health, whatever schools you might have at your campus. Reports and publications and published annual reports of hospitals can really be a trove of information, and I'll say more about this later. You could have the papers of health practitioners, educators, biomedical researchers, and by that I mean not necessarily their published papers, although you could have some of those, but really unpublished material, things like correspondence, and that is especially important because it gives insights into their thinking and their relationships, both professional and personal, and their activities. You might have their own administrative records if you have the papers of someone who served as a department chair or a dean. You'd have documents that they created. Many healthcare practitioners and educators are involved in drafting policy and legislation, or they're on committees. I mean, for example, David Kessler, who's a former dean of the medical school at UCSF, is now on Biden's COVID-19 committee. You could have research and data sets. Of course, photographs. Everybody loves photographs. And then in my experience, and I bet in some of yours too, archives can and do also include items that one would associate with a museum. And, physical objects and artifacts. And sometimes there are good reasons for keeping them in an archives collection. So, medical instruments can be of interest, and they're good for exhibits and outreach, especially instruments and objects belonging to well-known practitioners. And with some science collections, it sometimes helps to keep the equipment and instrumentation to help to understand the data, understand how the records were created. Sometimes those things are too big to keep, and maybe you would just want to take photos and document them. And I'll say that an archives in a health sciences setting is also more likely to find potentially hazardous materials in an incoming collection. I mean, any archives will occasionally, I hope only occasionally, have to deal with things like pests and mold in an incoming collection. But in the health sciences, sometimes we find specimens or hazardous materials or controlled substances and more. So a lot of books or articles about archives and how to do it consider the archival functions in this order. So acquisition, you acquire materials; appraisal, and I'll talk more about this later, but it's kind of deciding whether this belongs in the collection, what you're going to keep or not. Description, processing, cataloging, and then access, making them available. And I will cover each of these, but I'm going to change the order a bit because this progression works if you're looking at the life cycle of the materials. But I'm going to start with description because few of us have the luxury of starting with acquisition. I'm going to go with our relationship to these records because most of us, we start in a job in an archives and there's already stuff there. So that's where you have to start. Well, that's where I'm saying we should start with, what do you have? And you have things there, maybe it's described, maybe it's not. It could be in various states of preservation. It might be stuck in a closet or a file room, or maybe you're lucky and it's all in a nice climate controlled vault or area. And if so, congratulations. So let's consider these 3 questions in this order, and though you may end up considering them concurrently at times. But so first, what do you have? So you want to get a handle on what you have in your archives. And with unique and rare materials, it will take years to fully know the collections, and that's okay. But a good way to start is with an overview, at a minimum, a shelf list or an inventory of all of the archives collections, listing what they are and where they are. And perhaps some of you already have this step covered, and if so, congratulations. So then you would move on to more detailed description. But before you get too deep into description, you might want to ask yourself why you have some of these things, and how did it come to you? Is it, are these founding documents of the institution, so of course you should have them? Is it, somebody cleaned out a closet of old books and it's a mixed bag of what they are, and you're not sure why you have it? So those are things to think about when you're setting priorities. So and so this speaks to the importance of appraisal that I mentioned before. And I should say that this is not appraisal in the monetary sense. You're not assessing the financial value of any of this. And in fact, it's as you may know, institutions are prohibited by law from putting a monetary value on something that is donated to them. But basically, when archivists talk about appraisal, we refer to assessing the long-term historical and research value of the materials. And it goes, as Kenny Rogers would say, knowing what to throw away and knowing what to keep. And I'll go into this a little bit more when I talk about collection development, but it can help in setting priorities for processing your collections, because you don't want to put a lot of resources into describing something that you don't really want and that you might get rid of. So let's talk about processing. That's another one of these terms that archivists use, and it refers to arranging and describing the holdings. And so here are some terms and acronyms that you're likely to encounter in your archives journey. So describing archives, a content standard, that is the main, known as DAX, that's the main descriptive standard for archives. Encoded archival description, it's an XML document type definition, and it refers to encoding finding aids. I don't believe that a lot of people really actually do the encoding themselves. These days, there are programs like ArchiveSpace that does that on the back end, but it's something you may need to know about. MPLP, more product, less process, that's it's come to refer to just doing a minimum amount of processing, and it refers to an article written in 2005 that recommended that, and I'll talk about that a little more later. And so 2 basic concepts, though, to keep in mind when you're arranging archives are provenance and original order, and that is to preserve the context of the records. And so what is meant by provenance is where did this come from? So you may have a record group or series that is, the records of the Office of the Dean of the School of Nursing. And that would be one collection or group of records. And then you might have a scrapbook that was donated to you by a nurse that worked at your institution, maybe documenting her experiences in World War II. And that would be a separate collection. Even though both of them involve nursing, you wouldn't put those materials together. And then you might have some photographs from a physician who was in the unit that your medical center sent to help in World War II. And then that would be a collection on its own. And so you wouldn't mix things from different origins together in a subject just to create a subject collection. Although you could display them virtually, do a virtual exhibit and scan things and put them on the web, but they would be housed, each in their own place. And then original order is just what it sounds like. When if an original order is evident, you would keep things in the order that the creator put them. So if a lot of people used to file their correspondence by date, and if that's the way someone filed their correspondence, that's the way you keep them, in the archives, even though, you might want to say, oh, look, here's their like April 1960, May 1960, and like going through all of those, you may notice like, well, there's this person they have frequent correspondence with. Wouldn't it make sense to put those all together? And yeah, it might, but that if that's not how they arranged it, then then you shouldn't rearrange it. Now, sometimes there is no original order. I've seen collections where somebody drops off a plastic bag full of paper, no folders, and good luck with that. And in that case, the archivist would impose an order on that, but you would certainly document that and say that you did that. So description and discovery, they go hand in hand, because of course the reason you're doing this is to make your materials discoverable and usable. And description, it can be an iterative process. So, as I recommended earlier, first you really need to start, you maybe want to start at the repository level, like what do you have? Just have a basic list of all your collections. But I think the next thing you would really want to do is have just a baseline description, like a collection level record, something maybe like a MARC record for each collection. And those can be reported to OCLC's National Union Catalog of Manuscript Collections to make them visible to the public. And then for larger collections, or where you want to get into more detail, you would do what is called a finding aid, and that has certain elements such as biographical or historical notes, a scope and content note that tells you, basically overall what is in this collection. If there are several series, you would do series descriptions, and in the past, most finding aids did include a folder listing, and it's possible, you may still want to do that. But the point of I mentioned earlier, MPLP, more product, less process. And the point of that article, and it's on your handout and you can read it if you want to. I don't know that you really need to read it. But the point of that article was that so often the default was we described every collection at the folder, we listed every folder and we went through, and that is ultimately not sustainable. So you need to make some decisions about, do you want to describe everything at the folder level? You probably don't. If it's an important collection, you do. But sometimes you may be able to say, okay, here's box 5 is correspondence from 1960 to 1980. And you put that on your finding aid and you call it a day. The downside of that is you don't get, you're not bringing out like everything that's in there. A researcher will really have to come in and look through that to see if it has what they want. But the upside is you can get more processing done more quickly. if you're doing minimal level processing. So there's trade-offs. So you would kind of scale it to your situation. And I just wanted to mention the National Library of Medicine's Finding Aids Consortium, which is up here. So if once you have finding aids, it's very easy to submit them to that. And so this is a way that, you know, NLM can really help you, help make your collections discoverable. It's a very low barrier for entry. You do not even need to have EAD encoded finding aids. They take PDFs. So that's really nice. So essentially, the approach I'm recommending to processing is what's recommended in Dan Santamaria's book on extensible processing. And so I would say that, you know, if you read only one thing about processing, read Dan Santamaria's book. I think you'd be better served reading that than reading the MPLP article. So, you know, he recommends you create a baseline level of access to all collections material. So that's, you know, as I was saying, like if you just get a MARC record level description of each collection, that's good. And then, you know, you might move on to more detailed description of the, you know, the collections that warrant it, and, you know, conduct further processing in a systematic but flexible way, and manage it holistically, big picture. And I also wanted to recommend the book by Pam Hackbart-Dean and Elizabeth Slumba about managing processing, and that's more of a big picture treatment of managing processing. And Pam Hackbart-Dean is at the University of Illinois at Chicago, so she's local. But actually, before moving on to acquisition, I did want to talk a little bit about reparative descriptive work, and there are many others more qualified than I am to talk about this, and you know, that might be, you may want to get someone in for that for a future webinar, but that includes several things, and it could include surfacing materials that document experiences of underrepresented people, people of color, indigenous people, and you know, women in some cases. Sometimes women are underdocumented in medicine. But it also means being mindful of outdated or offensive language in legacy descriptions and going forward. So there are many libraries that have made use of this you know, the stay-at-home orders in various states. Like people, they have their employees working from home. So one type of project that many places have undertaken is reparative descriptive projects, where they're having people kind of go back and look at the metadata and update it with more inclusive language, and getting rid of outdated and offensive language. And you know, it also refers to describing materials in a culturally sensitive manner and using language that centers the humanity of the people that you are describing. And that sometimes means going beyond standards and using other taxonomies, and many, and unfortunately, I do not have the links to these taxonomies, but there are many community-based taxonomies suggesting, you know, with terms that you can use. I mean, for example, you would use non-binary person rather than gender non-conforming, because the latter term carries some judgment with it, whereas the former does not. And an excellent resource that is on your handout is the anti-racist descriptive practices. And there's a lot to be learned from that document. And also documenting the now, that is also on your handout, also has some resources for that. So let's get to acquisition. So this is my third question. What do you want? So what you want to do is be documenting people, functions, activities. And so your collecting policy is really like defining the scope of your collection. What do you want to have in your archives? What will you take? What will you not take? Um, some archives, they say they want to be purely an institutional archive and not accept materials that don't have anything to do with their institution. And that sometimes, if that's your mission, that's your mission. Other places, they want to expand, into certain areas. So it's, do you want to build on the strengths of what you already have? What is your institution known for? Do you want to develop in a subject area? And an example of that is UCSF is known for collecting in the area of AIDS history and also tobacco control. And I mean, there are many collections at UCSF that are in those areas that aren't necessarily from people who are there at the institution, but they decided we want to document the AIDS epidemic, and so we're going to collect materials in this area. So they're just things to think about. Or do you want to fill in gaps? Do you want to say, hey, we had a strong African American community at this institution, but we don't have a lot of materials from them. And then you would have to think about, well, how are you going to do that? So the kind of the two ways you would get materials in are via records transfers, and that really relies on developing a network of department administrators, and you would get things from campus offices, and you might want to get into records management, or that's a big activity to get into, and so but you may want to get into it unofficially. Of course, donations, those are external, and it's important with donated materials to have a deed of gift, which is a document that would formally transfer ownership of the physical materials to the archives or the library. Sometimes people would also transfer their intellectual property, their copyright. It's encouraged to do so because it can get problematic managing copyright if a donor retains the copyright to their materials, but there may be good reasons to do so. Excuse me. It's important to manage donors' expectations, because some donors will want to put conditions on their gift sometimes. And, if someone says, I'll give you this, I'll give you my papers, but I'm also giving you my medical instruments, and I want you to put them on permanent display in the lobby. Well, if they want you to do that, you have to stop and think, do we have the resources to do this? And if you promise to do something like that, well, then you better be able to do it. So there are things to think about. Sometimes donors want to put restrictions on access, and sometimes that's okay. I mean, a reasonable restriction would be if someone had sensitive correspondence with another person and they wanted to say, I want you to restrict these letters until after the death of this person, or they might say until 10 years after or 25 years after the death of that person. And that's a reasonable restriction, because you can make these things available eventually. An example of an unreasonable donor restriction, and this is from a former workplace of mine. There was a donor who was wanted to give his papers to the archives, but the provision he wanted to put on was that we could not give access to any person who is an enemy of the state of Israel. Well, that's a access restriction that's impossible to to implement. I mean, how would you know that? Would you ask everyone? And it's also kind of not, it goes against archival ethics to have a restriction like that anyway. So I mean, and the archives ended up not taking that collection. So, you know, lots, you know, donor relations is a whole other course in itself. And, you know, you may want to bring in somebody to do that at some point. But I'll also say sometimes donors will give money to fund the processing of their papers. And I've been in situations with that, and that's always nice. Sometimes they'll want to fund digitization of their materials. So, you know, donors, it's important to maintain good relations with donors, and it's also important to manage their expectations. Frances mentioned anniversaries earlier, and those are a really good occasion for acquiring materials and for both internal and external, and for building goodwill. And, you know, a lot of times, or sometimes, an anniversary, it's the impetus for starting an archives. But of course, you know, collection development, this is where appraisal comes in. And you can't appraise collections in a vacuum. It's something you really need to discuss with your stakeholders and you know, your library director, your leadership. And you know, it's because there are always trade-offs in taking any collection. And of course, you know, acquisition is another thing that's been affected by COVID. And I know people who, there are some libraries who, while they are shut down, they are not taking donations of archival materials. There are others who are making provisions for some kind of curbside pickup. So there are a lot of different things you can do. So I think right now we will stop for a question break, and I hope there are questions.
I will start with one, if that's okay, Lisa.
Sure.
So you mentioned the provenance and the order. And that very much depends then on how it comes in. So you could have one collection where the order is chronological, and then another collection where it might be arranged by subject because that's the way the person had it done when they gave it to you. Is that correct?
Yes, yes. And the reason that you maintain the original order is because that actually is part of the evidence, and it's part of it's part of the context of the materials. So and you know, it's just like I myself, because I mean, when I have correspondence, I personally arrange it according to correspondence. So I have all my letters from this person here. But you know, well, I mean, I've just seen this in many offices. It's like they would have what they called a cron file, and it's just like everything that comes in this month is here. And you know, it makes it harder on, I mean, I admit it makes it harder on the researcher to find things. It makes it harder on the archivist, because if you want to like make it known that we have correspondence from, you know, such and such a person, you have to do a lot more looking at the actual documents when you're processing them.
Okay. A couple of things have come in on chat. So
Sure.
Jeanette Bradley asked, she said, our director would like to create an archive or some sort of chronicle describing our library adventure during COVID and as we merged two separate hospital systems. I'm hoping for some ideas for getting started. What should we record, why, and how? And what's a good starting point for documenting events?
Okay, well, I am going to talk later about documenting COVID, but for documenting events, there are a lot of ways, different ways to do that. If there are websites, it's good to, capture web pages, and I am going to touch on that later. You can talk to people, you can do interviews, I know people who, like, for example, with COVID, they are saving all of the campus emails that are coming out that have come out about them, and you can do things like, save them to PDF, or there are programs that save emails. Actually, one of the sources on your handout, Documenting the Now, has resources that talk about different ways to document events and current events. I would certainly pick up any kind of printed ephemera. Of course, if you're not on campus, you can't really be picking up printed ephemera. But there are things like at my previous hospital, there were printed things that were put out, like the protocols for screening for patients for Ebola, and I got a few of those to keep in the archives. So I hope I'm answering this question. And if you're starting from ground zero with starting an archive, what you really want to try to get are like some of the core founding documents of your institution. And if your institution is very old, hopefully they're still around somewhere. If you're starting a new institution, like there are places that'll start a new medical school or a new nursing school, then great, that's an archivist's dream. Get there right away, make sure you're talking to the founders, and you can get those documents, get that, talk to them, maybe do an oral history interview, get their insights on their experiences.
Great, thank you. We've got another one. This is from Eric Edwards at the State Library. To what extent should medical archives use 3D printing to create models of medical instruments that may be too fragile to display publicly? And if a library doesn't have a 3D printer, are there any practical alternatives for creating models?
Wow. That is something I haven't thought of, but that is a really great idea to use a 3D printer for doing models of medical instruments that are too delicate to display or too fragile. I personally don't know of alternatives to 3D printers, but that I have to say, that's a really great idea, and I wish I'd thought of it.
Eric's very good at those things. Next is from Ruth Humphrey. Instead of printing little magazines with features about employees and departments, our marketing department only has online items that seem to disappear after a few months. How can a tiny library staff cope with the vanishing of our hospital's history?
Yeah, that is a very tough one, because I mean, like I said, there are web archiving programs. Some of them can be, expensive to get into. One thing you can do, and it's not perfect at all, and I don't think you can really do this on a sustainable basis, but you can, if you're vigilant about it, you can capture web pages as PDFs to save, and that's kind of a messy solution. It's something, actually, though, that I did. at when I was at Weill Cornell, because at one point they acquired what was the New York downtown hospital, and that had its origins in the New York Infirmary for Women and Children that was founded by Elizabeth Blackwell, who was the first woman to receive an MD degree in the United States. Anyway, on their web pages, they had their website, they had all of this great information about Elizabeth Blackwell, about their founding and all of this. And, New York Downtown Hospital. Well, on July 1st, 2013, which was the day it became part of New York-Presbyterian Hospital, and it became New York-Presbyterian Lower Manhattan, I think. All of that website was gone, baby, gone. But there is this thing known as the Internet Archive that just that captures websites on a periodic basis. And so I went to the Internet Archive and I managed to find like the June and May versions of those pages, and I downloaded them from the Internet Archive and turned them into PDFs. So I had those, but it was just amazing how it's like in a day, boom, that was gone. So if you can, so with the ephemeral PR things that you were talking about, if you can kind of get them yourself before they go away, great. But if not, they might or might not be on the Internet Archive, but that it's sporadic. I mean, I was lucky that they had those pages from New York Downtown Hospital that I was able to capture and preserve. So I hope I've answered that question albeit in a rambling way.
I think it's helpful. I know Ruth commented, and I was thinking while you were saying this, Lisa, a lot of these marketing stories are on our internal intranet site.
Right.
So don't get posted to the broader web. And I think ours is like a SharePoint site. So it is a challenge.
It is a challenge, and SharePoint.
Yeah. We all agree.
I'm not a fan of SharePoint, but I probably shouldn't say that, but yeah, so that is where it's kind of similar to paper, but more intense and problematic, where you really have to have relationships with administrators and get them to think about these things as records in the same way as paper. So it's like in the same way that, after a time, you might send paper files to the archives. You've got to get people thinking about, well, there are these things on SharePoint that we want to end up in the archives. But setting that up for to bring in these electronic files, that is a non-trivial task. And if you're just one person, maybe that's something that you can't quite do that right now, but it's something to think of for the future. But yeah, I mean, SharePoint, that's a whole can of worms, and it's like, would they give you certain permissions? And I mean, I know that there are reasons why some people have access to certain documents and other people don't, and we could talk all day about SharePoint.
Go on all day about that. That's the last of the questions that have appeared in chat. If anybody wants to unmute themselves and ask something, feel free to go ahead. We can give Lisa a chance to catch her breath, get a sip of water or something like that too. So we'll take a moment for that.
Okay. Should we move on then?
I think so. Thank you.
Okay. So, here's this other way that archives are different, and that it's the access to the materials is mediated through an archivist. So the nature of archival collections makes reference more labor intensive. And as librarians, you're familiar with the reference interview to get it to the question that the patron is really asking, which might not be the question they start with. And this is especially important in archives because most of the materials are unique. And this is the only set of a certain hospital's records or of a physician's correspondence or research notes. So a user might have come across a name in a Google search and they know that this person was at your institution, so they want to know everything about them. And then the archivist would need to spend some time looking through the collections in order to answer the question or to make digital surrogates of documents or photos, or to prepare for the user to visit the archives. And if the materials aren't digitized, and many are not, the researcher has to come to the archives. On-site reference is mediated and supervised, both to ensure safe handling of unique and rare materials and for the archivist to serve as a resource throughout the reference session. So it's not uncommon for a researcher to essentially take up residence in your reading room for a day or a week or longer. And so, but you want to also have a welcoming, inclusive space for them to come to. And of course, that's how it used to be. And today, many libraries and archives have been closed for months due to the pandemic. And some have reopened and are starting to reopen. And almost all have pivoted to offering some remote access to their collections, although that can be challenging. But before I go into some possible considerations for reopening, I wanted to talk about the importance of keeping reference statistics for the archives separate from your library reference statistics, and especially if being the archivist is only a part of your job. And I would say track not only the number of transactions, but the amount of time spent on them. And I mean like time spent interacting with the patron, whether that's via email or phone or in person, and as well as the time spent searching and researching and pulling materials, which can take a lot of time. And so I've discovered, well, the archives might have fewer reference transactions than the library, that archives reference transactions tend to take more time. And due to the nature of the materials and the need for interaction with the patron, and just in kind of communicating the value of the archives, I found that it helps if you can use some of your statistics to tell a story. So for example, at a previous job, the hospital embarked on a major PR and fundraising campaign called Health Matters. And that included some historical content. So they worked with the archives, and archives staff helped with research. We provided images, we edited and fact-checked content, and assisted with filming videos. I'm even in a few of those videos. But I tracked all of that time using the notes field in our reference tracking system, so that when it came time to submit the archives portion of the library annual report, I had my usual figures about the number of transactions, which were good numbers for us, but puny compared to the rest of the library. But I bolstered that by being able to say that the archives spent, so many hours supporting the hospital's development campaign and supporting the medical center's mission. And if you have an anniversary coming up, that you'll be providing a lot of support for that. So that's something that you can point to, and keep track of the amount of time and effort that you spend on that. So about reopening. So a lot of libraries do have new procedures for COVID-19. The discussions I've been following, places will sometimes quarantine materials after they're used. They have to wait a few days. They'll wait a day or two before they go and put it back. Places have temperature checks for patrons and for staff, although there are some concerns for privacy. There's a big discussion about that with the SAA privacy and confidentiality section, because apparently some of this temperature data, it goes into some electronic system and database, and it's like, okay, where is your temperature data going? Is that health information? But a really good source is the Realm project, Reopening Archives, Libraries, and Museums. And this is also linked on your handout, and they have these reopening toolkits. One of the things that they are doing is testing various library materials for whether the COVID virus can remain active on them and for how long. So really good source. So, some of the questions you might get. So here are some things that you can use archives to study. Of course, the history of places and people, social history, personal history, genealogy. So we can see some of that in these pages from the 1919 annual report of the Presbyterian Hospital in the city of Chicago. And I found this online through the Medical Heritage Library. So I thought I'd pick an Illinois document here. And I chose 1919 because there was also a pandemic going on at the time. But we can get information about some of the conditions in Chicago, what, and conditions at that hospital. And, the excerpt at the bottom right talks about the hospital's work with the poor, and that out maternity service refers to, visiting visiting patients at home, women who have recently given birth. But that talks about, it gives insight into attitudes about the poor, but also attitudes about the young women nurses. I found that interesting. Like, these young nurses had never before seen such conditions. They did not know they existed. Their sympathies are enlarged and broadened, and the appeal of their hearts is instant. So I find things like this really fascinating. And then, of course, on the left, there's the list of house staff, which these reports often included. And those are a real source for genealogy. I mean, often I would get requests where people like wanting lists of house staff or medical students from certain years. And if you have these reports digitized, it's really easy to do that. It's particularly recently, and this has made some medical archivists nervous, as they get requests for lists of house staff it's usually from years in the 60s or 70s, because at that time, fertility clinics at academic medical centers used medical students and interns and residents as sperm donors. And so now with 23andMe, people get their results, and if certain surnames come up again and again in their relatives, they're using these lists of house staff to track down their biological fathers. It's a very interesting and unanticipated use of these things. And I'll talk a bit about documenting biomedical research, although I'm not sure how many of you this applies to. If you are at an academic medical center, biomedical research is certainly a big area. And it's something that can be challenging for archivists, in part because the records of scientists are just so voluminous. And so here are some of the types of documentation typically found in a scientist papers. And of course, along with the usual correspondence and photos, there's some that are particular to science, such as research protocols, data. And then with equipment and instrumentation, sometimes an archives might want to keep some of that in order to understand the records, or at least keep some photo documentation of it. And, as I said, data, it comes in many forms. It tends to be voluminous. It can be difficult for anyone other than the investigator and their team to interpret. And all of these are concerns for archivists. And another wrinkle is that much of the research at academic medical centers today is funded by National Institutes of Health, National Science Foundation, or other federal funding agencies. And both NIH and NSF require data management plans for the research that they fund, as well as some data sharing. So out of necessity, an infrastructure is arising to handle research data sets. And libraries have stepped up to take an active role in helping scientists meet these data management requirements in many places. And there's also a role for archivists to advise on preservation issues, to identify data sets that are of long-term historical value, beyond the compliance period, and to work with IT colleagues on strategies for permanent preservation of those data that warranted. And well, of course, if your library already has this covered, great, because this is a big piece to bite off, especially if you're a one-person operation. I really don't think that like one person alone could do data management services, but it is a way to support your institution if you have the resources to do it. So that kind of segues into in-reach and outreach. So outreach is making your resources known to the public. In-reach is making your archives, its resources and services, and its value known to your parent institution. And I would argue that in-reach is more important than outreach, because the leaders of your institution are your stakeholders, your resource allocators, your primary funders. So you need to demonstrate that the archives support the institution. Here are some ways you can do that. And as always, scale it to your situation and do what you can manage. But of course, forging alliances with administration, including the C-suite, and as well as development officers and faculty, is key. Archivists are stewards of the historical assets and the vital records of the institution, and so much more. Archival resources can support a range of endeavors, including student and faculty research, education, grand rounds presentations, development functions such as reunions, fundraising, anniversaries, groundbreaking, donor events. And, I've found that development officers can be among your best allies. And if you cultivate a good relationship with them by providing historical content to support their events and campaigns, they may keep an eye out for future funding opportunities for the archives. And, I would say, don't despair. I've heard people despair this. They're like, well, we provide all these images to development and they raised all this money from this donor for, whatever, and we didn't see any of it. And that may be true at first, but the way I look at it is you're supporting them. So I can say, the archives, you supported the hospital's fundraising campaign, and yeah, the archives didn't see anything from that Health Matters campaign, but my contacts in the development office, if they saw opportunities for, to get some funds for the archives, then they would tell me about it. So it's really good to work with your development officers. I can't stress that enough. Other ways you might support the institution are, records management, data services, we already talked about. And so the goal is for the archives to be perceived as part of the vital infrastructure that supports the mission of its parent institution, and not as some extra that can just be cut during lean times. And so outreach, that's making your collections, your archives known to the public through publicizing collections online, holding events, exhibitions, reaching out to faculty at local schools and colleges, and also through venues such as American Association of the History of Medicine and local history groups. And I suspect that many of you are already doing things like this in your library. And if so, congratulations. Let's see, how are we doing for time? So let's see, this might be a good place to break for some more questions if more have come in. Looks like maybe.
We've got comments in the chat box, but no questions at the moment. So take a break, Lisa, and let people think and mull, and either post something in chat or unmute yourself and ask your question.
Do I want to look at the comments, or are they brutal?
Oh, no. People are making just comments about, somebody said maybe create a list of funding generated via archive activities.
Yes.
Beth St. John just says, this is a great picture that you have on right now. So no, comments are
okay.
popular.
Yeah, actually, that is a very good idea. And that's what I was kind of getting at with that reference stats story. And this picture that I have right now, this is from a campus event. This is that's me at a continuing education event that was held by the Department of Cytology. It was the Papa Nicolaou's cytology tutorial. And so George Papanicolaou, who's the man in that photograph, and that's his microscope, he was at Weill Cornell, and he developed the Papanicolaou smear, which the ladies in the audience were familiar with, I'm sure. And so annually, one of the faculty would host this. It's a continuing education event, and cytologists from all over the country and the world would come to it. And they really liked having this historical component of, they liked to see his microscope and, look at his artifacts, and those are his slides there. And it's doing events like that is a really fun part of outreach, and it's kind of a fun way to use your collections. So do we have any questions, or should we move on?
Ramuna says, partnering in services for InReach that involve more than archival staff and team, so that archival activities and holdings aren't in a silo.
Yes, that's a very important point. And yeah, and that's especially important if you are understaffed, is to build these relationships, build these teams, work with colleagues, because you cannot do it all yourself. And so, yeah. All right. So we'll move on. So here's a not very fun topic, but one that we need to think about. So medical archives are likely to contain patient records or patient information. And as health sciences librarians, you've probably all heard of HIPAA, specifically the HIPAA privacy rule, which might or might not apply to your holdings. So here are some key takeaways. And the first might seem counterintuitive, is because people think of it as a barrier to access, but actually it can provide a path to access. I mean, that's what one of my former bosses, Nancy McCall, used to say. So like even before the dawn of HIPAA, archives did not give unfettered access to patient records in their holdings. So rather, we worked with our institution's legal counsel and medical records personnel, and we looked at state and local laws, and we tried to draw up fair policies for access that protected the privacy of patients and allowed for research. So HIPAA laid down some guidelines laid down the law for that, albeit some problematic guidelines. An important thing to note about HIPAA, the HIPAA privacy rule, is that it applies to information rather than to records, so that many items that are not necessarily patient records are affected. So, and I've found that, PHI turns up in the darndest places. It can turn up in the form of patient information conveyed in correspondence or in photographs, or, I was processing an electronic collection and there was PHI in PowerPoint slides. So, because they would say, oh, and here's a photograph of my cured patient. So you really have to be vigilant for it. A 2013 revision to the privacy rule states that information on patients who have been deceased for 50 years or longer is no longer considered protected health information. And this came about because of the advocacy of archivists. Many of them, wrote letters, but two archivists, Steve Novak and Nancy McCall, testified before a committee of Congress to talk about how the privacy rule presented difficulties for providing access to historical records. So, but while this news was welcomed by archivists and historians, the access is still problematic, because note that this exemption is tied to death dates of individual patients, not to the age of the records. And then again, just because an individual's information is no longer considered PHI, it doesn't necessarily mean that we just open the floodgates on patient records. And then, state and local governments, as well as institutions, are allowed to set policies that are more restrictive than HIPAA, and the stricter rule prevails. Also, different institutions interpret the privacy rule in different ways. So it's very important to work with your institution's HIPAA compliance officer and the legal counsel. And then, of course, in addition to HIPAA, other privacy laws might affect materials in archives. If there are student records, FERPA would apply. If there are personnel records, appropriate privacy regulations would apply. And so it's important to learn your institution's policies on patient, student, personnel, and human subject records. But before you go and talk to your HIPAA officer, and warning, that person is likely to be very busy, it might be hard to get their ear. So it's good to have some information and some proposed protocols in mind. So here are some resources that can help you, and all of these are linked on your handout. So if your holdings contain patient information, an important question to ask first off is, whether your institution is a covered entity under HIPAA. And that can be complicated. So the federal government site, Are You a Covered Entity?, can help. And even if your parent institution is a covered entity, you will need to determine whether the library and archives are considered part of that covered entity. In some places they are, in some places they're not. I think every place where I have worked, the archives and library were considered part of like the overall covered entity. Like, the University of California, San Francisco is a healthcare provider. It's a covered entity, and the library is part of it, for example. But I believe that at Harvard, the Center for the History of Medicine is not considered part of, the Harvard Medical School or any of the teaching hospitals. So it is not part of the covered entity. It is not subject to the HIPAA privacy rule. So that's something you need to find out, and your HIPAA compliance officer could help you figure that out. And then archivists, continue to advocate for changes to the privacy rule and more importantly, draft some common standards and protocols for archival repositories. And the practice of privacy is one such example. And I would say, if you can read only one piece about HIPAA, read the practice of privacy, because this is just the best source. And it includes a section, recommended practices for enabling access to manuscript and archival collections containing health information about individuals. And so it's kind of a blueprint for common standards, and it can give you some talking points before you go to talk to your HIPAA officer. And the HIPAA resource page, it's jointly maintained by librarians, archivists, and museum professionals in the history of health sciences, and by Society of American Archivists Science, Technology, Healthcare section. There are some good articles there and some government documents, but some of the links are out of date, I discovered. And here are some Illinois patient records law. Again, all linked on your handout. So here are some agencies that tend to fund archives work, and the URLs are on the handout. And I also encourage you to look at private foundations and donors. Often if there's a foundation that has a kind of a pet subject or cause, they can, you might be able to craft a proposal. And also private donors. I mean, there sometimes a private donor will fund the processing of their papers, and you don't really have to press that hard. And then, as I mentioned before, development officers, they can really be good allies. And if you're helping development officers with their campaigns, help furnishing them historical content, they'll often look out for you too. So, and I don't mean that to sound as transactional as this is coming across, because it might or might not happen, but it's always good to build those relationships. So I wanted to talk about some digital resources that can help. So this is the Medical Heritage Library, and they have many, many digitized books, images, documents. They have a really good searching tool. If you have digitized materials, I encourage you to submit them to the Medical Heritage Library. If you go to this Collaborate tab, it'll tell you how to do that. And if you're writing a grant to digitize materials, it helps. They want to know how you're going to make materials available and how you're going to publicize them. And so the Medical Heritage Library is a great venue for doing that. And in fact, the annual reports that I showed earlier, I found those on the Medical Heritage Library. So if we have time at the end of this, I might, maybe we can go on and find some more Illinois materials. And I'll also mention that tomorrow they're having their 10th anniversary conference. And I think you can still register today. That's what Hannah's message there says. Thursday. You have until today to register for that if you're interested. Okay, the National Library of Medicine, History of Medicine Division. That is one of your best friends. So they provide venues for helping make your collections discoverable, such as the Finding Aids Consortium. They also provide guidance and best practices, as well as digital collections that can help you to answer all those history reference questions that you'll be getting, because now that you're recognized as the history person. Um, and images from the history of medicine is especially helpful for finding elusive images, especially, if there's something that a patron wants, but you don't have it in your collection. Images from the history of medicine is a great source. And as Steve Greenberg reminded me, 2 important words looking at NLM websites is scroll down, because these are often long web pages if you don't immediately see what you're looking for. I also encourage you to subscribe to their blog, Circulating Now. And that is also a great way to publicize your collections, your materials, because they welcome guest posters, and they often have posts from people, at institutions around the country. Of course, as you know, professional associations, a great way to network, to benefit from the knowledge of your colleagues. The Society of American Archivists, as I said, that's the National Professional Association for Archivists, and some of its resources, such as their journal, The American Archivist, are available only to members. Although I think during the COVID crisis, and I don't know if this has ended yet or not, they were making the American Archivist just open access, I think all except but the most recent issue. So, but that might have ended. But a lot of their resources are available to non-members. And they have their 2 sections, the science, technology, and healthcare section, and the privacy and confidentiality section are especially pertinent to health sciences archivists. There are other sections that you might want to join. We talked earlier about documenting current events. There's a web archiving section that has a lot of good information. And of course, anybody can read their blogs, and the privacy and confidentiality section has a really active blog. But SAA is very expensive to join, and if this is only part of your job and you're just starting out in it, you might not want to, it might not be worth it to pony up the cash for SAA, but membership in a regional association is a really good way to network with archivists in your area, and those dues tend to be a lot less expensive. The Midwest Archives Conference is one of the strongest, most active regionals in the country, and there's even a local group, Chicago Area Medical Archivists. The Medical Library Association has a History of Health Sciences caucus. So if you're already a member of MLA, which I suspect many of you probably are, then you can join that. And there's even an association just for us, librarians, archivists, and museum professionals in the history of health sciences. And they provide an informative quarterly publication, The Watermark, a friendly and helpful listserv, and a network of colleagues focused on historical collections in the health sciences. And I just highly recommend this organization. And dues are only $15, so who doesn't have 15 bucks? And Russell, our webmaster, told me to apologize for the long and weird URL for the website, because the website's in a state of transition, because we just changed. It was formerly 2 different associations, Archivists and Librarians in History of Health Sciences and Medical Museums Association. So we merged, and there's still a lot of things being worked out. So the URL on your handout, that's the current URL for the website, but we're hoping to get a more simplified one. And so finally, wanted to talk a little bit about documenting COVID-19. So, one way is to take a web archiving approach, which NLM is doing. And, here we see a screenshot of that. and then others are collecting from people at their institution, and that could be memorabilia, could be photos, could be writings. Some places are using a Google form for people to put in their, information. Some are using an in-house form that's more secure. And the American Libraries article that was linked on the handout, that discusses a few different approaches, and documenting the now, which I know is linked on your handout. And that has, that's a Google Doc with links to COVID-19 documentation projects across the country. And I didn't do a screenshot of that because it's just some, boring Google sheet with a list of URLs. But if you go to the links, it's not boring. We could talk about some of the further resources, and not just for documenting COVID, but just all the further resources that are on the handout. With the bibliography, the SAA Basic Manual series is really, really good for delving into specific areas of archives. So rather than listing each of those separately on the bibliography, I just put a link to the Basic Manual series, so you can go and look at that and just get the ones that apply to your situation. And I'll say for the most part, the links to the articles are links to the actual article, but the links with the books are just links to where you can buy those books if you are so interested. So we have some time. Let's see, how much time do we have? Oh, we have some time. So do we want to take some questions now? We could maybe do some look at the Medical Heritage Library at some of these Illinois things, or why don't we see if people have questions?
Sure. Nobody has put a question in chat, so if you want to do that, please go ahead, or again, you could unmute yourself. And somebody says Medical Heritage Library sounds cool. Okay. Somebody else would like to see the Medical Heritage page. So if you want to go to that, Lisa, that would be super.
Okay.
Oh, and someone asks, are archival supplies important to house what you have?
Yes, and I can't believe I did not talk about archival supplies. What was I thinking? Yes, it's very important and there are several sources of archival supplies. The two big ones are Gaylord and Hollinger Metal Edge. So yes, you would want to rehouse, rebox, refolder things into acid-free boxes and folders. And yeah, I can't believe it. Well, I know one of the photos on one of these previous slides shows archive. Okay, here, let me just do slideshow. What slideshow from current slide? So yeah, so here you can see these are archives boxes that you would get from an archive supplier. And the thing about Gaylord is that many libraries already have an account with Gaylord. So I've noticed their archive supplies tend to be a little more expensive than Hollinger Metal Edge, but sometimes it's just easier if your library already has an account with Gaylord to, tack that onto your library's next supply order. Although I should say it's a non-trivial expense. So anyway, so are there any more questions about supplies or?
Nope, that's the only one that came up. But yeah, probably you are so used to, it just is so second nature to you that it didn't even occur to you.
Right. Well, which, that's okay. So I think I might have to stop sharing and then share again to get to the Medical Heritage Library thing. So okay. Stop that. And then let me Oh, it looks like there is lots of chat, but I've not been able to really read it. Okay. Okay, let's see, share screen. What do I want to, here is what I wanted to share, Google Chrome. So this is a search that I did already in anticipation of this, and I did reports and Illinois. So we have like lots of things here. So the first things that come up are these State Board of Health reports. So you can filter things by the year or by like different in Chicago or Presbyterian Hospital of Chicago. So I don't know, what would people like to do? We could just open up one of these and take a look at it, or did you want to, yeah. Let's see if I can see, can I see the chat here? No.
Someone is asking, how do you determine what to digitize? I think people wanted to just see what this looks like.
Yeah. Okay.
Oh, and then Ramuna says, when libraries are downsizing, this medical heritage library is a good thing to check in case someone has already digitized state or local journals.
Yes, that is a very good point.
Oh, and somebody asked, what about the flu pandemic from 1918? So maybe we could look for something like that.
Yes, okay. That's, and what does that say here? Loading. Oh. What is going on here? Oh, okay. So let's try and filter by 19, by year, like let's take 1918, 1919, 1920 and apply our filters here. Because that might surface some things from the flu pandemic. But yes, I know of several archivists who have done exhibits and events surrounding the 1918 flu pandemic. And, you know, they'll bring out materials from that time. And this is, it's you know, serendipitous, but it's also kind of sad. It's like, but like, here we have this going on now. But, you know, I have a friend who did this whole presentation and he showed things about, you know, people wearing masks, people resisting wearing masks. And I mean, that was happening even then. It was, you know, there was a point where people were like, we're not wearing these masks anymore. And then another wave of it hit. So let's see, we can find something here. 5 to 1956, what is this? So, oh no, this is 1920. Well, that might have something from, so once you're in something like this, you could search. So I could search for a term, influenza. No matches were found. So there's nothing about influenza in that one. So let's try this one. Because sometimes in hospital reports, they will talk about things like how they dealt with the influenza. So we have two results here. So, well, this is not about the pandemic because this just refers to a paper someone wrote about the influenza. And let's see what we have here. And same thing here. So sadly, we are not really turning up much on the influenza pandemic, but
that's okay. People are commenting. Someone found something in, I think, the Internet Archive, History of Chicago Hospitals from 1922 that discusses it.
Okay.
And somebody mentioned that our HSLI Webmasters Institution, Eastern Illinois University, had an exhibit, and Ramuna put a link in here.
Oh, great, great.
A question that came up was about how do you handle duplicate copies of things? Are they worth keeping? Would you digitize and keep one? So if you had, say, 2 of these historical documents from your institution from, just say, 1922,
Right.
do you tear one up to digitize it and then try to keep the other one intact?
Well, that's a good way to go, because, all right, yeah, I see someone's, oh, I'm into the chat. Someone is mentioning the state journals, and that is a really great source. It is. So yeah, that most places will keep maybe 2 copies of something at the most. Although I'll say the last hospital archives where I worked, I think we had several copies of the hospital annual reports. And so when we had them digitized for the Medical Heritage Library, I mean, we used a set that, I mean, we didn't care if they got wrecked in the digitization, you know. Although I have to say the digitizers we used were very careful and nothing got wrecked, in fact. But I also know of places who, like, that if they have an extra set, they're fine with it if they have to, chop out the pages. They didn't need to do that with the materials we had. But yeah, that is good if you have an extra set to use that for digitization. If sometimes you may want to, well, in a lot of cases, you may be digitizing something that is fragile, or it's a unique copy, and in that case you'd have to be way more careful, and not, you'd have to say to your vendor, look, we don't want you to chop off the binding. This has to be, you really have to set your specifications with your vendor for that. So what is Sam saying here? My library has not archived any of our college. They're sitting on shelves. There's no budget. Should we begin inventorying, archiving our materials in Excel or in our library's ILS? Well, I think those are both good solutions. I would think maybe you'd want to just start by doing an inventory in Excel, and then maybe you would want to do a collection record for each thing in your ILS when you're ready to do that. But I would think the first thing you want to do is just get an inventory of what's there, and then you might, once you see what's there, you might decide, well, some of this doesn't even warrant putting a descriptive record in your ILS. Oh, is there a resource that might be helpful in identifying and offering guidance on nursing uniforms in an archive? That's a really good question. And I don't know of one specifically, but, and I'm remiss that I did not put any nursing history specific resources on that list, because there is a Center for Nursing History in Pennsylvania, and it's very highly regarded, and they have some very smart people there. And I mean, I wouldn't be surprised if there is some kind of a source about offering guidance on. Oh, and UIC here. Well, now I really feel like a dope that I didn't identify a local resource, that there's a Center for Nursing History in Chicago. Well, UPenn, that's right. That was the one I was thinking of, the UPenn. But yeah, and nursing uniforms and caps and pins, that is just a fascinating material culture. So I've seen like questions from people trying to identify a nurse based on, well, if you look at this cap, like, did this school wear this cap? Like, some have a ribbon, some have a frill, and there are people who can really get down to those fine details of being able to identify someone's nursing school by the cap that they're wearing, by the types of uniform, and it's, Right. Well, that's what Ramona is saying. Yeah, archival boxes for uniforms, right? That you wouldn't use like one of those document boxes, but they do have these flat storage boxes for. Yes, yes. Francis is putting the Gaylord link to the textile preservation. Yes, I mean, and Gaylord does have preservation supplies for many different kinds of materials. Right. There are large size boxes designed for uniforms, clothing, and capes. Yes. See, right. And that I'm scrolling back through the chat, and someone is saying that it's important to make sure physical copies exist, as not everything can be successfully digitized. Illustrated newspapers are one example, and that's a good example. And another thing, and here's a kind of a digitization story, is that when a lot of medical journals and so forth were digitized or microfilmed many decades ago, they didn't include the ads. And for some historians, particularly public health historians, it's important to see the ads in older medical journals, to look at things like how were certain drugs and devices being marketed to physicians at that time. And so that's an instance in which the physical copy might be the only source of that sort of thing. Let's see. I'm looking through the chat here to see if there's.
I think you've hit everything, Lisa. It is.
Patron who wanted a photo of Lincoln seated. I know, and you can't just give this a sassy response like, yeah, there's a whole statue in Washington. Good. I see Ramona is also plugging the Medical Heritage Library conference. Probably. Yes, Library of Congress definitely has digitized collections. Right, nursing history resources, yes. Yes, yes. See, I was remiss in not putting any nursing history resources, but librarians are coming through for me here. And so thank you.
We all like to work together.
Yes, yes. Well, and that's good in archives.
Okay, Ramona says your top 5 to 10 tips. What would you say to the accidental archivist in a health setting?
Well, first it would be, let's see, know what you have. Like first find out what you have. And then, let's see, and then figure out what your collecting scope should be. I would also say learn about HIPAA, because you might have to know about it. You're lucky if you don't, if you're not covered by it. Really, the biggest one is kind of, yes, that's a good tip. Spend 30 minutes a day on it, even if you think you're too busy. Well, that's a good tip for anything. That's a time management tip. But really just develop that network of allies and, get to know the institution's leadership, but, your HIPAA officer, your development officers, your legal counsel, and just department administrators. And by administrators, I don't mean, well, I mean, to some extent, I mean the leaders, like your deans and department chairs, but really their administrators are the ones who know where the records are and know the day-to-day managing of those offices. And those are the people that are really going to help you bring into the archives what you need to bring in, those institutional records.
Okay, and
Some
one,
places hire archival consultants and temps. What are good sources to identify them? And by that, do you mean places like History Associates and the History Factory that that you can get and those are the two that I know of, History Associates and the History Factory, where they just have archivists on staff, and you can hire one to come into your institution and do your archives or set up your archives. As far as archival consultants, they're all over the place. In fact, you can hire me. I'm one right now. So, and actually SAA has a list of archival consultants as well. Although I should say that as far as temps, that's becoming a big issue in the archives profession, as the issue of temporary and term limited labor, because there are so many people that they just go from one temporary job to another, and it's like a 1-year term and a 2-year term, and they're constantly job hunting, and there's a lot of discussion on the ethics of that or lack thereof, and how it's eroding the profession.
becomes sort of a gig economy of
Yes, yeah. And I think that's probably the case to some degree in libraries as well.
I know in some places it is, yes. If anybody has a final question, we'll give you 1 more minute. I think, Jess, we will have the chat as part of our recording, although I'll try to make a quick copy of this right now. You all should have received an email from me, Frances Jones Silvers, last week. So feel free to email me for something that you missed. I've been taking notes as well, just because I'm learning so much here. And if we don't have anything else showing up in the chat, I just want to say on behalf of HSLI, and I think all the attendees, Lisa, thank you so much. This has been very informative. I know I have certainly learned a lot. I feel a little less intimidated if questions come in. I feel like I would still have a lot to learn. But you've helped me even understand how to use archives better. So we're just so very grateful. Thank you.
Well, good. Well, thank you. I'll thank all of you. And, like I said, this is just, we just had a limited time here, but if you follow some of the resources on the handout, and really, look at some of the books and educational offerings from SAA, I think can be really helpful. And MAC also is great. And, like I said, at NLM, the reading rooms are closed, but the reference lines are open, is what Steve told me. So,
sounds wonderful.
A lot of great people, great resources there.
Well, again, Lisa, thank you so very much, and hope everyone has a good afternoon and rest of the week.
Yes, have a great afternoon, everybody.